In light of federal budget announcements, the government has pledged to invest $49.1 million into women's healthcare. This investment is aimed to support women with endometriosis, a chronic and incurable disease that affects 1 in 9 Australian women. It is expected that by the 1st of July 2025, 2 new items will be added to the Medicare Benefits Schedule that includes extended consultation times and increased rebates in specialist gynecological care. But Melbourne gynecologist Dr. Rebecca Mackenzie Proctor says it's still not enough.
So it's great. There's a start. Okay, it's a start. But it's not everything, and it's not going to be really enough. If you look at the way the budget is put across for all the other areas as well, it's still only tiny. It's a drop in the ocean, but I'm glad that it's there.
Having endometriosis can be costly. According to the Department of Health and Aged Care, 87% of Victorians had out-of-pocket treatment costs. Last year, the average cost for specialist treatment was almost $4,000, and patients were out of pocket by more than $500, even after Medicare rebates and private health insurance. Melbourne wife and mother Paddy Pardillo has been tormented by endometriosis for the past 31 years.
I was diagnosed with endometriosis at the age of 16, but I had suffered the symptoms way before then, probably at the age of like 11.
She says it hasn't been an easy journey, and it certainly wasn't cheap.
It was a huge financial strain for my parents. Then me being married with a husband, young family, I think it was even harder.
Having longer appointments may not be as useful as the government thinks. Pardillo would like to see more funding going towards educating existing specialists about endometriosis.
Extended consultation times is great if you are seeing a doctor that is knowledgeable in endometriosis. Otherwise, it really is a waste of funding.
The fund is a huge step towards greater support for women's health, but it leaves Australians eager for the next step. Elisha, RMIT Newsline.